It's an absolute pleasure for me tonight to be here with Dr. Sanet, Dr. Press, absolute greats and well-known, obviously, in vision therapy. And great to have Robert Nurisio here with us as well, to be able to talk about the, Dr. Sanet's very well-known seminar that he's done for many years. Bob, how many years has it been now?
This will be my 25th year presenting these series of seminars, and my last year.
Last year, that's what I was just about to say. So I have to say, as someone that wouldn't be here today, I can definitely tell you that, or have practiced in vision therapy, or done all the things that I've done throughout my career, if it hadn't been for your course. I mean, I took your course many years ago, and it was really what gave me the confidence to be able to get into vision therapy and to be able to really pursue and help all the hundreds of patients that I've helped over time. I know there's many clinicians that would be right there with me saying very similar sentiments. Tell me a little bit about what it's like for this to be your last year doing this.
Well, first, I'd like to thank you for your very kind comments. And also I get positive feedback from other people as well on the impact that the seminars had on their careers, their confidence, getting started in that. It being the last year is challenging in some ways and not in other ways. It's time. I don't know how to say it in a different way. Not comparing myself to any of the people I'm going to discuss, but there's been great baseball players or great football players or great, artists in other areas. And I think that the thing to do is to know when it's time. And I'm comfortable with my decision that this is just my last year. It's just I'm comfortable with that decision. But it's tough because I'd love to teach, and I'm going to miss the people a lot.
I'm sure it was a very difficult decision to come to. Tell me, I think many would love to hear maybe a couple of anecdotes, some of your favorite experiences over the 25 years you've been teaching the course.
I'll just mention a couple. One is it's incredibly gratifying that people have repeated the course over and over and over again. It's not uncommon for people to take it 2 times, 3 times, 4 times. The record right now is Dr. Nancy Torgerson, who's in her 12th sequential year of attending all 5 seminars. So, and she gets something out of it every time, obviously, otherwise she wouldn't be making 5 trips down to San Diego to attend and bringing more staff members and more staff members. But many people attend it 2 or 3 times and usually get more out of it the second time. Actually, that's something that's said a lot, that I got more out of it the second time than I did the first time, especially with new people, because they hear it the first time and there's so much information that they can't absorb it all. So if they repeat, and again, a lot of people repeat, probably more than half the people, maybe 70% of the people repeat a second time or more than a second time.
I'm one of those. Yeah.
And the second time they can just listen and really deepen their model and their confidence. So that's been incredibly gratifying that people are willing to attend more than once and get something out of it again and again. And that's one of the beauties really of the videos that are going to now be available or are available. And that's that you can watch it again and watch it again and watch it again and share it with your staff. And discuss. There are doctors who watch the videos and, for 1 hour every week with their staff, and they watch a segment and then they discuss how to implement that in their practice or what they learned from that or how they might use it in their practice. So people who have purchased the videos have found them very valuable in that way, that it's like attending another year, but at no additional charge. So that's been one area that's been just tremendously gratifying. The other, I'd like to share actually a recent occurrence. There was a woman, an optometrist, who came to my seminars last year for the first time, who was just doing it just out of curiosity, really, more than anything else. And she was looking to get out of optometry. She was so bored with optometry and frustrated with optometry and being on all kinds of insurance plans and all the things entailed with the paperwork with that, and on and on and on. Her name is Tiffany Martinez. Tiffany, after the first seminar last year, called her husband and said, "We're not selling the practice. We're changing the practice. We're going to institute vision therapy in the practice." And right now she has 4 therapists. And I think about 50 people in vision therapy now. And she says, "I love to go to work every day. It's exciting. It's interesting. I'm making more money than I made than before." And that stories like that are very gratifying to me as well. So anyway, that's the 2 things, I guess, that come to mind. There's lots and lots of stories, but those are the 2 things that come to mind.
Dr. Sanet, I have a question for you.
Sure.
So I was lucky enough to attend your seminar in 2003, 4, and 5, and then, again, last year in 2023, this year 2024. Granted, I have a different set of eyes and a different set of ears, different set of ideas than I did back then, but it seems to me that your seminar has evolved and has changed. As you just said, for a lot of people, you create an evolution or revolution within their practice model. Can you describe for us how you feel like your seminar has changed over 25 years?
Sure. I'll begin again. One of the reasons I think that people come back every year, actually, is because the seminars are a little bit different every year. And I don't say the same thing. It's not like going to a lecture where you hear someone. There's people who speak at the American Academy of Optometry, to just name one Congress. But you hear these lectures, and it's exactly the same lecture every single year, word for word, with the same slides, the same information, and nothing has changed in 25 years. So one of my goals always was for me to grow and me to learn and to bring more information in as I learn and get better. The major way I think it's changed, actually, is my evolution through my model. In the early years of the seminars, I was very much involved with an accommodative convergence model, which helped a lot of people. It's a good model. It's not a bad model. It's a very good model. And you help a lot of people just on that basic Brock string, flippers type of a model, and people get better. But as it's evolved over the years, I've gotten much more into individualizing the therapy for a specific person, and getting at the true root cause of things. And also, I believe so much more strongly than I did, even though I believed strongly in 2005 in the benefits of lenses. My belief in the prescribing of lenses, when I say lenses, that's plus lenses, but also microprisms and yoke prisms to change behavior, has been a large part of the evolution of that, and also getting into, like I say, the root causes of what the person really needs on an individual basis, rather than just looking at a mechanical way of improving accommodation or improving convergence, really improving the way the person sees the world, but not only sees the world, the way the person sees themselves. and can make those internal changes within themselves. It's been a remarkable evolution for me, and also for many of the people in the seminar that come up and say to me, thank you so much. The information was interesting, but you've changed my life through what I learned in the seminars as well.
Well, I would like to second those people, as someone who's known you quite a while and someone who's learned many things from you. The value that is in treating the person as opposed to treating the visual condition or the diagnosis in the computer. The value in treating the person is something that I will forever be grateful to you for showing me, because it's helped me grow so much professionally, but also just personally, to be able to understand why we need to do that, and to find who people really are, and what they mean to themselves, what the world means to them visually and otherwise. Thank you for that.
You're welcome. Thank you. And hopefully through the demonstrations, the hands-on demonstrations that I present in the seminar, that people can learn the way I organize the procedures, the way I speak to the patients during the procedures, how I modify the procedures for a particular individual person. I think is the real strength of the seminars, how the seminars have grown. And you hit the nail on the head, Robert. I used to treat a convergence insufficiency or an accommodative infacility or whatever. And now I realize that those are just symptoms of a much deeper underlying problem that we can get at through vision therapy. So not only did the findings improve, but the patient is truly different. One of the things I'd like to say, Robert, is I don't want the same person with better accommodative skills and virgin skills walking out of the office. I want to have a different person walking out of the office in every single way possible, who also happens to have better accommodative skills and eye movement skills and virgin skills and perceptual skills. And that's a real paradigm shift in my thinking and the way I present my seminars now as compared to 20 years ago when you first took the first seminar.
Yeah,
Can I ask another question? I'm sorry if I interrupted.
Yeah, no, go ahead, Robert.
Well, can I ask another question, kind of rolling with that theme? Often in your seminar, you discuss, or you'll make the statement that the patient will tell you what they need. And a big part of that is the value of listening and shutting your mouth and just paying attention to what they're telling you, physically, verbally, what have you. Can you elaborate a bit on how you feel about that, where the value is in just that skill of listening?
Yeah. Again, it's hard to communicate in this way. You sort of have to see it to understand it, and that's one of the value of either attending the courses, which again, this is the last year, or watching the videos. But one of the things we don't do as much when we're doing in therapy, especially when we begin to do therapy, is we really, again, just go through the mechanics of the procedure rather than listening to the person. And through the demonstrations on the videos or attending the courses, you observe me thinking out loud, if you will, about what the patient is telling me by their responses. So that the response could be something that triggers an old memory. The response could be something that triggers fear in the person. The response could be issues with interpersonal relationships that they have. That is manifested through a visual problem. And when the visual problem is, when the procedure is presented and administered in the best way possible, you not only get these changes in the visual abilities, but you actually get changes in people in terms of their awareness of issues in their life that are impacted by this visual problem that they never even realized were connected to their vision.
a piece that I always admire about you, Dr. Sanet, both in person, but also it comes through very clearly in the videos, is your ability to make space for people's emotions, for their needs, for their wants. Can you speak to the importance of that step for you?
Sure. One of the things I try to demonstrate is creating safety for the person so that the person understands that I'm on their side, that I'm there for them, that I can listen rather than speak all the time, which was an evolution myself in my own growth in terms of not talking, or telling the patient, but actually prompting the patient to respond in a certain way or responding to what they say rather than organizing it the way I want it to be. And that has made a remarkable change in the benefits that I derive from the therapy I did with patients, as well as the feedback I get from people like yourself, Robert, and many other people that they were doing a Brock string before, they were doing vectograms before, they were doing all these procedures that they knew, but not getting the maximum bang for the buck, if you will, so that their NPC improved, but they were still sort of the same insecure person or with other types of issues. And again, I'll just take Tiffany, who we spoke about a little while ago. Yes, she learned procedures that she didn't know or what better to do it, but she got some insights into how she could not only help her patients much more, but she made a tremendous amount of internal changes in terms of how she viewed people, how she viewed her own value, how she and what she could do for patients. I've had numbers of people in the seminar tell me that they get along better with their significant other, or they're a better parent after attending the seminar. And that's what I try to communicate, that during this vision therapy procedure, you not only can get these improvements in the visual abilities, but if you organize the procedure correctly, one of my goals many times is they have better interpersonal relationships, that they become better parents, that they become better significant others to somebody else, that they're better for their patients. That's one of my big goals in the seminars, is to make those types of changes in the people that attend the seminars or watch the videos, so that they also not only are people who watch the video or attended the seminar, but they're profoundly changed by attending the seminar or watching the videos, and get new insights into themselves and have literally different directions in their life because of attending the seminars or watching the videos.
I think that has dual benefit. Number one, listening to you speak about it, but number two, taking those skills back and working with people and having a different awareness of ourselves, different approach, and watching really the metamorphosis that occurs during our sessions, and watching the power in it in real time. So yeah, I think that there's double value there for sure.
Yeah, I think that's maybe you said words that triggered something in me. The difference between 2005 and 2024 is the power. I'm so clear about the power of lenses, prisms, and vision therapy to make significant impacts, not just on measurements, but on all areas of the patient's life, some of which are very unexpected. And it comes from listening to the patient and observing the patient and their responses to the lenses, prisms, and therapy. And it's, by the way, it's also a lot more fun to do therapy. That's also, it's more interesting to me. it's not just rota. Okay, now we're going to do the vectograms. Now we're going to do the heart chart. And it's O, F, N, P, V, D, T, C, or flippers and things like that. After a while, therapy can become boring to administer. But if you now understand the true benefits that are possible through these procedures that people observe me doing in my courses or now on the videos, they realize how powerful these tools are and how they can truly change lives in very profound ways.
I would definitely count myself as one of those whose lives have been profoundly changed. I just remember so many times where I was just watching in your course, and one of the big things I took was you just were patient. I remember you were doing a stereo massage with someone, and I probably would have been okay doing it for like 30 seconds before saying, oh, this isn't working, I'm going to try something else. And you just stayed there with this person, and all of a sudden I just remember going, oh my gosh, I see depth. Before we get any further, I want to bring Dr. Press into this conversation. Dr. Press, without me going any further, I just want to ask you, how did you get involved with the Sanet seminar?
Well, until I gave this some thought, I almost didn't remember all the details, but I signed up for the Sanet Seminar in 2009, and my motivation for signing up at that point was basically fear of missing out. So
Some FOMO.
FOMO got to me. People kept lauding the Sanet Seminar, and I said, I need to do this, and I did it as many other ODs do with a therapist. In my case, I wanted to bring at the time the therapist I thought that would get the most out of it. And between the two of us, we would go back and share what we learned with the rest of the staff. Well, it's a giant binder, and the first week, Bob is lecturing, and I tried to be as incognito as I could. You know, this was Bob's course, but Bob kept looking at me and saying, what do you think? And during the first break, I said, Bob, I appreciate your asking me, but I'm here to listen to what you think. and then gradually I got the hang of it. But what Bob noticed was, you know, next to his slides, I was just taking copious notes because that's my style when I go to a course or learn. And so it's almost like I was creating my own parallel course while listening to Bob, and things that he said would just trigger thoughts in my head. And during, I think, the first lunch break, Bob comes over and he says, this is great. This is incredible. This is so through the first 2 weekends, I think both of us realized that at some point we would probably have to collaborate and do some sort of synergistic, something that we didn't know of at the time. So those notes that I just showed you when I created the commentary ultimately became these clinical pearls. And then as I was listening to Bob, periodically you'll see, I don't have one here, but the idea is there are little graphics of, oh, here's one. An airplane.
Yes.
So Bob referred to me as
infamous airplane
controller. And I would sort of help keep him grounded. And then when there were things that maybe were some of my pet things in terms of articles, references, studies, etc., when Bob first made me aware of this company that distributed his videos prior to you taking it over, Emergent taking it over, Ben, I don't think without viewing the videos, I've never seen anything in optometry, forget about vision therapy, but I've never seen anything in optometry where professional videographers were able to capture, because these are Hollywood people, the things that Robert and Bob and you have mentioned about helping attendees as well as patients feel safe, go through these metamorphoses, transformations, change. The videographers are able to capture that because that's what they do when they shoot film. They're out to capture emotion. They're out to capture communication. I've never seen anything done as beautifully as they did. And there's lots of stuff on the cutting room floor, but what you see is phenomenal. So while the seminars were live every year, in some way it was difficult to help people understand these two works, the videos, my commentary as a package, and Bob's live running course each year complement one another, but they're different. They're both excellent, they're just different. Well, going forward, there is no, do I do this or do I do that? The that of the live seminars is unfortunately, but understandably, gone after 2024. But you have this, and you have the videos, and you have the closest thing to this. And I just think, I'm biased, but I just think the whole thing is phenomenal.
Thank you. Can I comment on that just briefly?
Please, please.
It's Len and I actually first collaborated on a book chapter a number of years ago, where I wrote out of the pages and pages and pages and pages and pages and of just my airplanes and my thoughts and et cetera, et cetera, et cetera. And then Len edited it and put it into, a proper way, because Len is such a good writer and is such a good editor. And the joke we had between us is, my airplanes and he's the air traffic controller. So the same thing happened with the seminars. As Len just described, he started to take, because the way he does, he takes copious notes. And one of the most gratifying things actually for me in my seminars is not just what I present, but that it sparks a connection in somebody's brain, or an idea in somebody's brain, or wow, I could do this with this patient or that patient. And Len is a master at doing that. And so what he did actually, and why this package is so tremendous, is because you have me with my style of freewheeling airplanes going here, there, and everywhere. And then you have Len's commentary, either reinforcing some things or saying, if you want further information on this, here's some wonderful sources that you can go to deepen your understanding of this topic or that topic, or sometimes just giving an alternative view that, yes, this is true, but blah, blah, blah is also, these other things could also be alternative explanations or whatever. So it's a wonderful synergistic relationship of my style, which is much more out there, if you will, much more, to use optometric terms, much more exo, if you will, and peripheral, and then Len's ability to be detail oriented and specific with that, and it adds, Len's commentary adds so much to the seminars and the value of the seminars as well.
I'm going to jump in real quick. You both have mentioned the online Sanet seminar, and some people may not be familiar with it. I believe it was 2018. Is that the recorded version?
I believe it's 2017, but I'm not sure, to be honest. I believe it's a 2017 version, but there's some amazing breakthroughs in the course that you can see happening in the course. It was an amazing group of practitioners in that group.
Yeah, I happen to have the first slide, and it says 2017. So you're right.
Oh, there you go. There you go. So 2017, it was professionally recorded by the producer of Survivor, Joe Leah, right? And
Right.
he had, like you said, Len, I mean, just the way that they're able to capture better than just what you normally see, which is, you know, a shot of a lecturer from far away like we normally see in optometry. This really does capture the essence of that, the seminar. It's broken up into, you know, 45 or so minute segments. And so that is now available online through my company Emergent. At the end of this, I'll talk about how you can access that through our website, emergentvt.com. But the very cool thing is, along with that, like Dr. Press talked about, he put over a 500-page commentary that is in digital form, that when you purchase the course, you get access to it, and you can access it from any device, whether it be your phone or your laptop or your iPad or wherever it happens to be, you can access it. And it is just a tremendous resource for offices that we sold it to, talk about how they do ongoing training. And, oh, I remember Bob talking about this thing, and they can go right to it and pull that up. So yeah, that's something that we're excited about, that we're able to continue the legacy that really Bob has put together from doing 25 years of seminars.
Thank you. That's one of the things that's really important to me. This will be my last year, as we've spoken about again and again, of presenting the seminars, but also I want to have a legacy that the seminars really are ongoing and people still can access the information in the seminars, and actually in some ways access it in a much more usable form, in a sense. Not that you forgot to write something or you missed something that I said or whatever, but be able to watch it again or stop the video, go back and listen to it again, go back and listen to it again if you want to, or again, to discuss, watch a 45-minute segment and then discuss it with your staff on how you might implement those things. By the way, we didn't mention it, but these seminars also have a tremendous amount of practice management information.
Mhm.
So I also go through how to speak to patients and parent conferences and other things as well.
I love that. I'm actually going to go to Robert. I wanted to ask you a question. You know, you attended several years in person, but now you've had access to the online version of the course. I'd love to get some of your thoughts on what you noticed as you started to go through and watch those.
Many things, but to choose a few, the first thing Dr. Sanet said a moment ago about being able to back up and listen again. I think, Dr. Winters, when you and I first spoke, that was one of the first things I told you, is even having the opportunity to listen to Dr. Sanet live over several years, having the ability to back up and think about it and say, okay, I'm going to listen to that again, and then think about it, and then maybe apply it to a patient or apply it to a specific activity is invaluable. The other thing, if I can kind of progress into another question, is something that really strikes me about the videos is when you attend Dr. Sanet's seminar, the information is fantastic, the presentation is wonderful, the group is great, but there's an X factor. There's I don't know how to describe it completely, but it's something like love or energy or something in there, and that comes across so well in the video. Like, having been there live and then witnessing that on the video, I cannot articulate it well enough how much that comes through. And I feel like that, I mean, the passion that's presented, the passion Dr. Sanet has when he's presenting, the emotion that's behind it, the space he's creating, the safety he's creating, like, all of that is evident in the video. And that is probably the most powerful thing for me, because I very much work that way. I'm very kinesthetic about my patients and how I present things, and just having access to hearing Dr. Sanet's tone of voice, hearing Dr. Sanet's presentation, hearing the emphasis or the intonation that goes along with each presentation, that is so valuable, just to have that available. And as I said, go back and listen again, or zip through a part that I don't need. You know, I mean, he as a therapist, when he speaks about neurology, some of it I understand, most of it I don't. I can just kind of pass through that and say, okay, this is what I want over here, and that to me has been fantastic. I actually, if I may, want to ask a question of Dr. Sanet and really Dr. Press as well. So, Dr. Sanet, during your seminars, there is that X factor, and as I said, I don't know how to describe it, whether it's love or energy or how you would describe it, but I'm wondering if you can try to put into words what that is, because as someone who's attended several seminars from many different organizations, many different people have been presenting, I have never experienced that before, as I have with you, and also, like I said, it comes through in your videos as well.
There's a number of factors, Robert. First, I would have to say that I really respect the people that are coming to the seminars, and I respect the level they enter the seminars with. So we have new therapists or new practitioners, and then I have very experienced practitioners come there. So I try to speak to everyone there. There's a term I use in the seminars, which I'll share now, and that's speaking to someone's listening. So when I'm in the seminar, I'm fully cognizant that, again, there's a new therapist or a new doctor that doesn't really know anything about therapy, let's say, again, like Tiffany was the year before last. And then I have people like Dr. Press or Dr. Torgerson or Dr. Lewis or Paul Harris, or on and on and on, of very high level practitioners who've been doing this for a long time. And they all share that they get benefit out of it, because I try to speak to all of them in various ways. And so I speak in certainly a longitudinal way, going from A to B to C to D, but I also speak vertically at the same time, presenting it that way. The second big thing that maybe has changed a lot since 2005 to now, although I still think it was there in 2005, but not as clear in my thinking or as clear in the seminars. And that's that I'm always cognizant of both speaking to people's minds, because I want to give a lot of information, but I'm also simultaneously and purposefully speaking to people's hearts. And the combination of the two, giving the information and also speaking to people's hearts, I think is what makes the seminar so special.
That definitely comes through in the videos. I don't understand videography enough to know how they did it, but it definitely comes through in the videos.
Well, I'm not sure how I do it either, to be honest. I mean, it's people. I've said this also in the seminars a gazillion times. I'm not a deep thinker like a lot of people. I don't analyze in a very deep level and ponder over why this or why that, or all the, I don't know, people speak for days or weeks on what do we mean by accommodation or what do we mean by virgins. And I'm glad that those people who are like that, they're a great benefit to our profession. It's just not me. So whatever comes out, and it comes from my heart. I love to teach. I love to make impact on people's lives in very profound ways. And I think you do that more speaking to the heart than you do speaking to the intellect, because most people have enough information or a lot of information. But it's just intellectual, and intellectual doesn't, I don't know, for me anyway, it's just like I couldn't go through life as an intellectual, if you will, just discussing blah, 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 blah. I need to feel people. I need to connect with people. And I make a purposeful effort, Robert, in every single seminar. And I'm glad it comes through on the videos, to make a connection with every single person in the group.
If I can piggyback on that, in the commentary, in the introduction, exactly what the two of you just said. So I'll just read a fast snippet. Bob has become one of optometry's masterful motivational presenters, to be sure, but there's much more to it than that. But by the same token, I think that's very important. Bob is a motivational speaker who happens to be speaking through optometry. And he's evolved to that point. I think earlier in his career, he was an optometrist who started to speak more. And now he's a motivational speaker who does an unparalleled job using vision therapy as his vehicle. And the fact that he's so passionate about both being a motivational speaker / teacher and about optometric vision therapy is an incredible blend. And then after that, I wrote, the key ingredient, it would seem, is his ability to establish a connection with attendees, the number of which is carefully capped at 40, to engender this chemistry. Together with his spouse, not to embarrass Linda, but the Uber-certified optometric vision therapist, Linda Sanet, Bob facilitates reflection and discussion among seminar participants in a way that is unique and life-changing to the point of being proprietary. So Bob has this proprietary approach that not even he can fully articulate, but there's nothing else like it.
Yeah, I couldn't agree more.
This is good for my ego. I have to say this.
Enjoy.
I never read that, Len, to be honest with you. Or if I read it,
stuff in this commentary that not even you know about.
Well, I probably read or I read it and I forgot it, which is also true for me a lot. But that's actually, to be honest, on a serious note, that's one of the nice things about having the videos and the commentary. You can read it again. You don't have to get it the first time. So I may have read that in 2018 when you wrote it, but it didn't stick, and now I'm hearing it again, and the second time it's like, wow, that's nice.
I could sit here and listen to this all night. Bob, Len, Robert, it's been so wonderful to have you here. If we could just end with one last question, and then I'd like to then go ahead and just tell everybody how to access the course. Bob, what's the biggest thing you're going to miss after 25 years of teaching this course?
That's exactly it. I'm going to miss the teaching. I'm going to miss the interaction with the people. I'm going to miss the intellectual stimulation. I'm going to miss the connections in the courses. It's I think Len can understand this, and also Robert. Anybody who teaches, and you also actually, Ben, anybody who teaches, when you can impact a student or a listener in a profound way and make a profound impact on their life, there's just a tremendous amount of satisfaction, and it's also humbling. I've been so fortunate and so blessed to have the opportunity to impact people's lives in meaningful ways. And I'm going to hopefully continue that in other ways, but certainly through my seminars, I'm going to miss that a lot.
We are all going to miss that too. Like has been said, fortunately, we can still get a good chunk of that with this online version of your seminars. If you are interested in that, I'd like to point you to our website, emergentvt.com. You can go there and purchase the course. It's a one-time purchase, and that is unlimited access. So that access doesn't go away, and it's access for your entire staff in your office. So everyone gets their own individual login so they can keep track of where they're at in the course. We have just got a lot of great feedback on the accessibility and how easy it is to be able to get in and to watch it at any point. So if you have any questions, please contact us. Thank you, Bob, Robert, Len, again for this time. Really, really appreciate it.
Thank you, Ben.
Pleasure.
And nice seeing you guys.